had multiple sores on his foot. At one point he had a sore kind of underneath where his little toe, his fifth metatarsal head was, and it got infected and he ended up losing part of his foot. That seems to be common when you get infections to lose parts, and patients with diabetes really suffer from that kind of a problem. When you start to get sores and ulcers, he has one here on the bottom. His particular problem is his foot in the back. He has a curve to the rear foot, or rear foot varus, and his foot is curved over to the side where he puts all of his weight on the side of his foot. Instead of walking flat on the ground, he's walking on the side. And we're going to be doing a reconstructive surgery to try and put this back together. We're trying to do some wound care today in preparation for that. So we have our patient back in today. His first visit after having surgery done, and as you recall, his foot had kind of a C shape to it, and the front part of his foot wasn't reaching the ground properly. His big toe was up in the air. After the surgery, we brought his foot back over this way, and now it's flat on the ground. So when this all is healed, he's going to be able to walk flat without getting ulcers on his foot. He's missing part of the bone over here, so it still looks like it's curved a little bit, but actually his foot is now straight where it ought to be, which is great. This big structure, the external fixator, this one's called the tru-lock. This is the one that we use for these reconstructions for Charcot and diabetes. And you know, patients who look at these are a little bit nervous about seeing them, but these are fairly light, and the only thing we worry about after surgery is pin sites that come through here. So we do things to kind of clean these up and keep an eye on those. This device will allow him to put some pressure on his foot when he's transferring from bed to couch to chair. And that's why we like to use this structure, so that they can still do a little bit of that transferring pressure. So the next step we're going to be for him is just keeping a wrap on his foot to keep the swelling down, and just kind of watching the pins. And taking x-rays every couple of weeks to make sure the healing's going well. And the sore is better. It's still healing, but better, yeah. Some of the complications that we worry about are infections, so we keep an eye on those. Other complications are sometimes these wires break. So here I'm checking these wires to make sure that they're all tight and there's nothing broken there. These all feel really good.